Welcome back to Mayo Clinic Radio. I'm Ian Roth.
And I'm Tracy McCrae, and welcome to the program. Ian Roth from the Mayo News Network.
Thank you so much, Tracy.
Have you been having a good summer?
I've been having a great summer so far.
Excellent, because that's what we're going to talk about today.
Yeah, we're talking about as summer vacation rolls on, you might find your children are looking for things to do. They've already been to the pool or off to camp. So what comes next? Often their first choice is screen time. Watching TV, playing video games, or connecting with friends via social media.
Oh, heavens, yes. The 2017 UNICEF report surveyed the online experiences of children around the world and found that children represent 1 in 3 internet users worldwide. That's amazing. Mm-hmm. And here to discuss the dangers of too much screen time is Mayo Clinic pediatrician, Dr. Angela Mattke. Welcome back to the program, Dr. Mattke.
Thanks for having me back.
All right, I know for a fact that my kids are playing Fortnite while we're recording this. So we gotta wrap this up so I can get home and bust them on it.
All right, we'll try and be quick then.
Okay, very good. So when it comes to screen time, first of all, were you surprised at the UNICEF report that 1 in 3 kids are internet users?
No, not at all.
Yeah.
No, not at all. Not especially not from what I see in my office, my daily setting. One thing we ask about all their well child checks is, how much screen time are they doing per day, and how are their parents monitoring it and being involved with it? And sometimes I'm blown away. Kids are 10, 12 hours per day. Yeah.
Oh my goodness. So what are the recommendations? Because I know that there's not 10 to 12 hours.
Right. Well, let's start with the little babies first. So as we become in a more digital environment, the younger children are being exposed to digital media at really early ages. And the recommendations are to not have young children to be exposed to it. And if they're going to do anything, video chatting may be an acceptable way. This is what I did with my children, with their grandparents, a lot of FaceTiming. They can learn through that environment, especially if a parent is sitting next to them. So having an adult sit next to them and explain to them what they're seeing, what they're hearing, that really helps translate that into something that they can understand. Otherwise, seen in a two-dimensional setting is hard for them to incorporate that into their brain and understand what's going on and learn from it, especially.
So that's infants and toddlers.
That's infants and toddlers. So
okay.
Between 2 and 5, it used to be 2 hours or less, but that was a recent update as of a couple of years ago, based on some emerging research that, as we saw, especially toddlers and preschool age kids use more media. Every hour per week, we saw increases in their BMI. So the recommendations are 1 hour per day or less of recreational or enjoyable kind of screen time per day.
And that's for a 1% increase in their body mass index.
Oh, not a 1%. So with every 1 hour per week of screen time, we saw increases in their BMI percentiles that were heading towards areas that were concerning.
Okay.
Mm-hmm.
Did you notice, though, that at every hour was replacing an hour that they were doing physical activity? Is there a direct correlation there, or
that's what the hypothesis is, right? So if we're taking away from sleeping, from eating, from playing, from practicing social skills, and doing more screen time, we are going to see detriments in other areas as well.
All right. So what about? So we've got infants and toddlers. What about the next age group?
So in teens, 6 and above, the recommendations are 2 hours per day.
Hold on.
Yeah,
we go from toddlers. There's nothing about toddlers to 6-year-olds in there?
No, there is. That's 1 hour or less per day.
Okay. All right. Gotcha. Yep. All right. So 6 and up.
Yep. So 2 hours or less per day are the recommendations for that. And I know that you're probably thinking, yeah, right. If we look at our own social media, our own screen time consumption, it's probably a lot more than that, even for adults. So.
And what is the difference, though, for teenagers doing over 2 hours of screen time versus adults doing the same?
Well, I'm going to just speak to the teenagers part, because that's what I see and that's what I know a lot about. But in teenagers, when we see that they are consuming a lot more screen time, there can be effects in all different areas. So their sleep, that's one of the biggest areas. So they're doing their screen right up until bedtime, and they're keeping their smartphone in their bedroom. And we know that affects their sleep because they're being interrupted, and they're also staying up later. And also that blue light that screens give off can affect your hormones that regulate sleep and your sleep cycles. Other things that can be affected, so obesity and their BMI and their weight. Kids need to be moving. We all need to be moving and to be active. And if you think that they're in school for maybe 8 hours, 9 hours a day, they need to have some time for downtime, right? They need to have time to be bored. They need to have time to be creative and imaginative. They also need to have time to spend with their family. They need to eat, they need to sleep, and they also need to exercise. And so if they're not getting exercise, if it's taking from that exercise time, we're going to see obesity levels increase. We also see effects sometimes in risk-taking behaviors. There's more of an association with that, and there's the idea that more acceptance of those things that kids are seeing on social media, thinking that this is what everyone else is doing. We can also see concerns with mental health. And so there's kind of this U-shaped curve that goes along with mental health in teens, with how much social media or with how much screen time they're consuming. So in the short end of ones that are not doing very much, we actually see a little bit higher increases of depression rates. And the thought is these teens are more observers of social media. They're not engaging and communicating, and then they're just looking at other people's posts on Instagram and things like that. So they're not getting that social connection and that benefit that we do see in teenagers and adults of being able to find other people to connect with and talk with. But then on the higher end, ones that are using significant amounts of screen time, we are seeing a lot more higher rates of depression in that area as well.
Do you think that that's a cause or a symptom of depression? Is if you're spending more time on your screens, is that a sign that the child might be depressed, or is depression being caused by all that?
I think that's a great question, and I think it's hard to sort out. I think you have to think about it from both perspectives. Is the child being more self-isolating from themselves, and so they're turning to that to fill their time, or vice versa? Is consumption of so much media leading to or contributing to some of the symptoms that they're seeing of depression?
So what qualifies as screen time here? Is it everything from the good old-fashioned TV down to their smartphone screen?
Yeah, it absolutely is. So it's really simple. Anything that has a screen in front of it, that's screen time. And these screen time limits really apply to recreational or enjoyable screen time, because kids are spending a lot of time in school and education learning with screens, which can be incredible tools to help them learn. But we're talking about the time they're spending outside of school, or the time they're spending texting in between classes or snapping and things like that.
Going back to the younger kids, when we're talking about toddlers and kids of that age, that we want to limit that, but you see it more and more often that your parents are out in public with their kids are acting out in some way, so they put a screen in front of them as sort of a babysitter or a way to calm them down. How do you balance trying to get control of your kids with limiting their screen time?
Well, first of all, I've never done that. No, I'm just kidding. The big thing is
me either, Ian.
Because we're absolute perfect parents.
Never would we do that.
But that's a great point you bring up. So we're using screens as a babysitter to help them calm down with their emotions, instead of letting them experience emotions and learn how to struggle through those emotions and calm down. So it's a missed opportunity that parents could be using. Maybe they're using it once in a blue moon. That I think that's certainly fine. You have to have flexibility, right? But using it every time their child gets upset to help them calm down as a tool is not a great tool. We want them to have better ones.
So that's the way that we were raised, because there was not a smartphone for our parents to shove in front of our faces. So we, as parents, need to learn. Just because we have this tool now, we don't just give it to the kids, like Ian said perfectly, as a babysitter.
Yep.
So play out what a parent should do when they're standing in line at Target and everyone around them is giving their smartphone to their kid to pacify them.
Right.
What do you want parents to do?
Right. So it starts before they get to Target, right? So this is like your whole parenting approach and your whole parenting model, which could be a whole other discussion for another day. But it begins with, labeling their child's emotion. If they're frustrated, I see you're frustrated, depending on their age. And then trying to distract them onto something else is a really good idea, but validating their emotions, seeing what they're frustrated about, and then just a firm no. If you will stick to it and you use that consistent approach over time, you're not going to see the meltdowns very often. We call it an extinction burst when kids escalate their behaviors as they get more and more upset because they're trying to push the limits to see how far they can push you before you give in. And if you continue with that same consistent approach, no matter where you're at, whether you're in Target or, you're at home and stuff, things are going to be okay. There's going to be ups and downs. My kids have temper tantrums in public and stuff like that, but just trying to stay calm yourself is also another thing.
I'm not a parent at this point, but I have nieces and nephews, and I think that from what I see, it's got to be a hard, fine line between treating screens as a privilege and a right when they're so ubiquitous around us all the time. So how do you navigate that of like, this is a privilege, not your right to be on a screen all the time?
I think it starts early. It starts with your approach, with your children when they're young, right? So I'm using it as a reward for good behavior rather than something that they're entitled to that they get every day, and try not to use it as a punishment. Does that make sense? So with children, we always want to try and encourage positive behaviors. When we start to be punitive and doing negative consequences all the time, things aren't as effective. And so if you can use that approach, it helps.
We've been talking about kids and screen time with Mayo Clinic pediatrician Dr. Angela Mattke. We're going to take a short break. Welcome back to Mayo Clinic Radio. I'm Tracy McCrae.
And I'm Ian Roth. We're back talking with Mayo Clinic pediatrician Dr. Angela Mattke.
So Dr. Mattke, recently the World Health Organization recognized gaming disorder as a mental health condition. And this kind of plays into what we were talking about before the break and screen time. And if you have too much screen time, it can start to affect your mental health. So this didn't surprise me at all.
No, it didn't surprise me at all either, based on, what I've anecdotally seen in my office.
So what exactly is gaming disorder?
So a gaming disorder is when their video gaming use starts to cause difficulties in all parts of their life. So it impacts their daily activities, their sleep, their physical health, their social health, their occupations, and their relationships with other people, to the detriment of their own health. And they have difficulty cutting down and go through withdrawal when it actually does occur.
What is the detriment to their own health?
So if we see things related to their mental health, right,
Okay.
that would be a detriment to their own health. If we see type 2 diabetes, obesity, high blood pressure, all kinds of things that we associate with a sedentary lifestyle.
And if you can identify what the addiction piece is, depending on what age the kids are, Ian, remember this. They will be able to know, I am addicted to this right now. They won't want to admit it, but it's true.
Yeah.
What do your patients say when they're in the office with you?
They will report that they feel that they can't disconnect, that they get scared about the thought of not having their digital devices available with them. It's not uncommon to hear that. Other kids have no problem whatsoever, and that makes sense when you think about the distribution in the population.
So pretend that you've got a 11, 12, 13, whatever age kid, and they're not quite sure where they fall on that line. What do you say to them when they're in the office with you?
Sure. So getting at the background of their questions and where their concerns are. So something called motivational interviewing is something that we use with all types of behaviors that maybe need to change. You assess where they're at and their willingness to change, and seeing if they can recognize maybe how it is affecting. And if they can say that and they can verbalize oh yeah, I'm not doing this. I used to do this. I used to enjoy doing that. If you can get them to say those kind of statements, you can use that to kind of point out to them look, you are recognizing it is affecting your life.
It can also be a fine line, though, about convincing a kid that it's harmful, because, I've had friends whose kids come back with the argument, well, I could be doing drugs, I could be doing other things that are more harmful.
See how smart they are?
Yeah,
it's
so
true.
Right. It becomes difficult to convince them that what they are doing is harmful to some degree, doesn't it?
It probably depends on the situation, and it depends on the child. So anybody who has some type of addiction, it's pretty hard for them sometimes in the moment to recognize their symptoms and how they're affecting their life and their relationships. So yeah, it can be difficult at times.
Can we expand this conversation out? We have about 4 minutes left, but into social media as well, because I think in some aspects, whether you're an adult or you're a kid, having social media contacts can be a good thing.
Absolutely.
But also can be a bad thing. So did you ever think when you were going to medical school that you'd have to work with patients on how to manage their social media?
No, I did not think that. I was part of the generation of Facebook. So Mark Zuckerberg and I are the same age. I remember when it rolled out at my university, in 2004 and stuff, and no one even knew what it was. So no, I never imagined that this would be part of my practice so much and such an integral part.
So what do you say at those well child visits when they're 14, 12, 16, whatever, about social media?
So I just start the conversation what do you do on social media? What apps are you using? How do your parents monitor it? have you ever felt threatened? Do you feel safe? I even ask questions about sexting and solicitation, because there are predators out there, and I have had patients that have been solicited or been attempted to be trafficked as a result, connections through social media.
How do you judge what's too much and what's perfectly healthy? I mean, I would imagine it's different for every person and for different age groups, but how do you judge when they're crossing a line?
When we start to see either some of their like biophysical profiles being concerning, so BMI, blood pressure, early diabetes, type 2 diabetes that we'll see in adolescence, or glucose impairment, problems with their liver, then you look at all of the other ways that it can affect their life. So their social relationships. Do they no longer go out and spend time with friends? Do they talk to anyone anymore outside of what maybe video gaming or things like that? How are their grades in school? How is their sleep? Are they feeling rested? All those kinds of things that you can actually, measure and stuff. And if it's causing those concerns in those areas, that's pretty concerning, right? If somebody had was not taking care of their high blood pressure, or was not taking care of their child with cancer, it'd be, a similar concern, right? And these also can cause concerns, not to that level, obviously, but in a different way.
And I'm sorry, go ahead.
Well, I'm part of the same generation. I was in college when Facebook came out, and I remember when parents started being able to get a Facebook account, and there was a big collective eye roll among college students and teenagers when their parents could be on social media. And I can see from younger kids' generation's point of view that when their parents are telling them it's too much, it's kind of like, well, you don't get it. You're not my age and you're not seeing that. So how do you balance those discussion points when a parent's trying to place limits?
Right. That's going to have to be a personal discussion with their own family, and it's going to have to be based on what they place as values in their family's life, and what's important to them, right? And I think they're going to have to just make that discussion together. It's not something that we can necessarily set limits on.
What has not changed since you guys were in college, we won't talk about when I was in college, but what has not changed is mental health issues. And so whether you've got kids that are 8 or 16 in for their well child visits, how has talking about that child's mental health, I mean, and this can be part of screen time and social media, but also, I mean, those things do play into or are affected by the child's mental health. Let's finish up talking about that.
Sorry, just to clarify the question, how screen time affects mental health? Is that what the question is?
Both.
Okay.
I mean, how is it that mental health, the mental health of your patients, how do you gauge that, and what struggles are they seeing?
Sure. So the American Academy of Pediatrics has recommended that all well child visits, we start screening for emotional behavioral concerns. And so we start that very young, and we are not necessarily screening for depression when we're young, but we're screening for other symptoms. As they get to their teenage years, we're doing here at Mayo, we're doing a screening tool called the PHQM at every well child visit. Or if concerns are there for an acute visit, we will get that questionnaire, and it asks a lot of really good questions that go into the symptoms and the diagnosis of depression. So we're using that to help screen, but we're also asking the question, right? So there's a difference between giving them a screening tool and asking them to fill it out, and also asking them discussion. So I say, how are things going? How do you deal with ups and downs? How do you feel like your mood is overall? Because sometimes it doesn't always correlate to what they put on their screening questionnaire, because their parents helped them fill that out.
We've been talking about kids, screen time, and mental health with Mayo Clinic pediatrician Dr. Angela Mattke. Thanks for joining us, Dr. Mattke.
Thanks for having me, guys.